Is it possible for every Ugandan, irrespective of age or socio-economic status, to obtain healthcare services at the international standard whenever needed?
During the year 2015, the United Nations rolled out an international agenda to promote healthy living and well-being for all persons of all ages.
This was intended to, among other things, achieve universal health coverage, including health insurance and access to quality, safe and affordable essential medicines and vaccines for all.
The 2020 government report on the implementation of the 2030 agenda shows that upper-staffing positions in public health increased from 56% in 2010 to 74% in 2020. Public health facilities increased from 2,867 in 2012 to 3,133 in 2018. The proportion of births attended to by the skilled health personnel increased from 58% in 2011 to 74% in 2016.
Between 2011 and 2016, the under 5 mortalities declined from 90 in 2011 to 64 deaths per 1,000 live births in 2016. Infant mortality declined from 54 in 2011 to 43 per 1,000 live births in 2016.
The maternal mortalities declined from 438 deaths per 100,000 in the year 2011 to 336 deaths in the year 2016. When we look at HIV/AIDS infection among adults who are aged between 15 to 49 years in Uganda, declined from 7.3% in the year 2011 to 5.8% in the 2019-2020.
But these changes are not enough. More needs to be done.
Afrobarometer data show that between the years 2017 and 2022, the performance declined. The number of Ugandans who report going without enough medical care when they needed it increased by 8 percentage points, from 23% in 2017 to 31% in 2022. Ugandans who report going without enough medical care when they needed it is mostly among the elderly, aged 50 years or more at 36%, those with no education at 42%, residents in the rural area at 33%, men at 35%, and those residing in the north at 41%.
Afrobarometer data show that between the years 2017 and 2022, Kenya is backtracking on health goals. The proportion of Kenyans who report having never gone without enough medical care when they needed it has dropped by 11 percentage points, from 46% in 2016 to 37% in 2021.
On the other hand, Afrobarometer data show that in the same period in Tanzania, from 2017 to the year 2022, among respondents who report having never gone without medical care when they needed it stayed the same at 48%.
But what do these results mean for Uganda? The government and other stakeholders need to, 1, increase investment in health infrastructure, human resources, and access to medical services. 2, promote good health and well-being interventions through routine immunization, capacity building, awareness raising, assessment, and rehabilitation by the Ministry of Health and its partners. 3, intensify the fight against corruption through increasing funding to enforcing bodies such as the Inspectorate of Government, the State House Anti-Corruption Unit, and partnering with NGOs that promote anti-corruption.